yeah, so you work with kids.
Yeah, I do have some pediatric patients for sure.
Does that mean they're coming in with certain symptoms, or is it preventative, or?
Most of the patients that I see, I find the parents are bringing them in because their immune system is low, they're catching lots of different bugs and viruses, especially with kids. They don't want to start giving them antibiotics for chronic ear infections and that kind of thing. So we work on using natural solutions to kind of help boost immune system. We do some, I work a little bit with helping kids focus and concentrate, just general nutrition for kids so they can be their best self, really. Yeah.
Yeah, I don't even know where to go from there because there's so many things you help kids with, right?
Yeah, and
I mean, I know you have a 4-year-old.
I do,
so
yeah.
You love working with kids.
I do love working with kids, yeah.
Yeah, and I know we talked earlier about how you help couples get pregnant.
Yeah.
So you like to be there when the baby's born and then afterwards to make sure it's a healthy baby, right?
Yeah, and actually my pediatric patients, a few of them have been the ones that I started with fertility and then pregnancy, prenatal, postnatal care. I was there as a doula, and now they're my pediatric patients. So it's great. And I think especially first-time parents with babies, there's a lot of anxiety around, is this normal?
Yeah.
My baby's awake coughing. You know, I've had some patients, you know, email in the middle of the night like, oh my gosh, my baby's not sleeping, what's going on? So I think just having a reassuring voice, just saying, okay, this is normal. Okay, let's take the baby into the doctor now. You know, is this fever normal? When do we let it ride? When do we do something about it? Just to have an experienced voice to kind of guide them through that can be very helpful.
It's so nice to have a naturopathic doctor. I forget the statistic I saw a few days ago about how many, this was in the US, but how many hundreds of thousands of kids under the age of 2 were on a certain prescription drug. I don't know what it was, but it's really nice to be able to take a natural approach to deal with some of these issues that babies face and little kids face, right?
Yeah, and they are finding like antibiotics for ear infections, for example, has been showing to not be very effective. It just sort of reduces a parent's anxiety.
Yeah,
so
there's so many problems that can come after that from antibiotics.
Yeah, exactly. So there's that. We can talk about picky eaters is a big one with kids too, and I usually talk to patients about how to get kids to eat their fruits and veggies and all the stuff that they really need to help build their body and their brains in the very volatile time of their life. Yeah.
Okay, that's good.
Yeah.